Welcome to Healthy Lifestyle. I'm Lorianne Casdia. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to fulfill a healthy, emotional, spiritual, and physical life so you can feel empowered to live the life you have always wanted and dreamed. Yes, I am tripping over my own tongue this morning or this afternoon, I should say, and it is such a beautiful day. I hope you are enjoying your day today. Well, today we are going to have some medical talk, and we have the great Dr. Nazir Lone on with us. He is an attending pulmonary and critical care medicine physician at Peconic Bay Medical Center. Before joining Peconic's team, Dr. Lone worked at Bassett Medical Center in Cooperstown. He went to medical school in India and then got a master's in public health at Johns Hopkins Bloomberg School of Public Health. Dr. Lone completed his residency and fellowship in pulmonary and critical care medicine at the University of Missouri. Welcome to the show, Doctor.
Thank you so much, Lorianne, for inviting me to this show. I'm really honored, and during these times of bizarre information and shows like yours are very important to uplift our all of us and our society and our patients. So thank you once again.
Oh, well, thank you for saying that. And yeah, we do our best here at Healthy Lifestyle and on JVC to try to get information out there, good information that people can calm themselves and be informed so they can make the best decision for them and their families. So here's a couple of questions. I just want to dive right in. So what was working in your capacity during COVID-19 like? So what are some of the things that struck you most at the time that you're now looking back at?
It was during the peak of COVID season. It was like a roller coaster ride. During our training and, fellowship residency training, we are not trained much on how to prepare for disasters and emergency preparedness. We may have some in-class lectures or simulations, but the real experience was really very different. Many times I felt like I'm skydiving without a parachute.
Yeah.
So sometimes it was feeling like the life has become more robotic. So it was pretty difficult time. Now things are a little bit settling, but we are not sure when the second peak will be there. But fortunately enough, we are a little bit ready for that as a medical professionals. So I think our supplies are a little bit. We have more ventilators now. Our staff is a little bit trained. Supplies are there. So all those 4 S's of disaster preparedness. We have improved in last couple of months.
Yeah, we're definitely seeing that growing trend. And anything new, we have to have a learning curve. So we need to find patience and calm and allow our professionals to find the right answers so that we can make the best decisions possible, right? So what impact does the COVID-19 virus have on people's lungs, being that that's your area of expertise?
Yes, so basically, it causes a rapid and progressive respiratory failure in a very short period of time if you become symptomatic and end up into the hospital or the ICU. Some people definitely are asymptomatic, but those whose lungs are involved, there is some research coming which shows that it can cause scarring, something called fibrosis of the lung in a very short period of time, and it also has some kind of a distinctive pattern of involving, causing some kind of small blood clots in the small blood vessels in the lung called microthrombosis. And in comparison with the other respiratory virus like Middle East respiratory virus or flu-like illness, it also causes something called angiogenesis, meaning it has got some tendency towards development of new blood vessels in the lung, which could be very harmful and have tendency to cause the thrombosis in those. So basically, research is still ongoing, but this is the preliminary information, whatever we have from the recent autopsy studies.
Sure. Again, this is all new to all of us. So who obviously is a real good in question. Who should be most concerned with the pulmonary perspective about the potential resurgence of COVID-19 in the fall? And do you think if someone's had it before, if they're going to get it again?
Well, I think, again, lots of things are still unknown, but we have seen that there are reports that this immunity goes away in a couple of months because the antibodies were initially present, then they started to clear up from the body. That is very highly possible it's highly possible, this is my personal opinion, that you can still get infected if you do not have an antibody in your blood. Now, there are certain high-risk groups like people who have got chronic respiratory disease like asthma, COPD, which is one of the fourth commonest disease in the world, or people have scarring of the lungs, people who have immune system problems, or who take medications that, suppress the immune system like chemotherapy, cancer patients, people who have significant history of smoking, or teenagers who have vaping and have caused lung damage, actually, there is high likelihood that their infections could be more severe and they may end up into serious consequences of this infection.
So they really need to be very careful.
Yes. Yes.
Yeah. Gosh, COVID-19 still has so many unknowns. I just, it continues to go. As much as we learn, we continue as we're trying to get that science behind it. We're finding new things every single day. And I want us all to be mindful of that. It's not that people are giving misinformation. It's just as we start compiling the data and sharing data across the world, we're trying to find tracks and trails and patterns that allow us to make good choices. So we need to really stay in there and understand that it's not misinformation that's going out there. It really is that we're in a learning growth because there are so many unknowns. So, but what do you think will be the long-term impact of this virus, specifically on people's lungs?
Once again, it's very much unknown, but once fibrosis starts, that means scarring starts, it is going to impact the lung and increase some kind of a comorbidities. Looking at other pulmonary disease or other kinds of viral infections, there are almost like 300 million alveoli in each lung. And whenever scarring develops, you lose some of those alveoli which will not participate in the function of this, lung, which is primarily the exchange of the gases, oxygen as well as carbon dioxide in our body, which is very important. So once you start losing some of those alveolar units, definitely you may have some problems in breathing in future. This possibly maybe oxygen dependent you can become in future. So once again, we do not know how because it just started. So usually we will come to know in a couple of months what are the long-term consequences in those who survived the severe illness, especially people who were admitted to the ICU as well as were mechanically ventilated.
Right.
Some of our patients do have these blood clots in the lungs and they are already being treated with blood thinners. So consequence of a blood thinner is some kind of strain on the heart also, something called pulmonary hypertension, which may develop if these clots do not go away or are massive enough to cause some initial damage. So once again, I think as you said, it's a learning curve, and we have to learn while we are dealing it. And I totally agree with you that there is not misinformation. It's based on the data. All I want to say is that we have to make sure that we make our, in addition to our physical distance, we make some increase the social intelligence, basically, like hand washing, interpersonal distance, cleaning the surfaces. Picking up the symptoms early, seeing the doctor early, calling someone for help, things like that. If we apply those at the societal levels, definitely we are going to, win this and prevail and come out of it in a stronger way.
That's a brilliant recommendation. And yeah, that definitely works in my house. I'm a little OCD, so everything is always clean, has always been cleaned down with Clorox bleach. So my house is a real nice safe zone, actually.
Oh, that's perfect.
So I've really not thought of separating health out, but you give me a moment to pause and think to myself, how should people think about pulmonary health, and when should someone see a specialist? Like, when should I call you?
I think if you look at the idea of this whole pulmonary system is like exchange of the oxygen in the lung as well as removal of carbon dioxide. Not only is the oxygen the main function of our pulmonary system, it has something to do with our cognitive system also. Our brain also works with adequate supply of oxygen and removal of carbon dioxide. So if there is any kind of deficiency in this system, you will have some kind of symptoms. If you look at an average person who breathes with a rate of 15 per minute, it approximates to around 22,000 breaths per day.
Wow.
And if you are 80 years old, it's like 630 million or 600 to 700 million breaths you take a lifetime, and each and every single breath is necessary for survival and gas exchange. So you don't want your breathing to be hurtful if you have any problems of pulmonary system. So basic symptoms, if someone is feeling short of breath, which is unusual for him, like, after exercise, everyone is short of breath a little bit. But if it is unusual, if someone has a new cough and new sputum production, he should see a specialist.
Right.
If someone has having fatigue or tiredness, he should see a lung doctor. If someone's spouse says that they snore a lot during sleeping, they are doing excessive daytime sleeping, they should also see a pulmonary physician. Yeah. Because lungs should not be seen as an isolation. So there are lots of other symptoms which may be associated with pulmonary disorders like fatigue, tiredness, coughing of blood, unusual weight loss,
allergies,
yeah. Things like that. You should see a pulmonary doctor.
Yeah, gotcha. So what can people do? Relatively simple at home to keep their lungs healthy. What can we do?
So basically, some things are very simple. I think as your program is about healthy lifestyle, I think you may have done yoga or something. Everything is related to sometimes in yoga about breathing. Simple breathing exercise which improve the lung capacity can be done at home. You should try to keep indoor quality of air very good by having some proper ventilation systems. Smoking cessation is very important. Nobody should be smoking at home, including second-hand smoking should be is pretty harmful, including the third-hand smoking. If there is smoke on the hands and you touch a small kid, that's like third-hand smoking, which is also very harmful. People should also use maybe a little bit, try to have less chemicals also. Soap and water is the best thing in home for cleaning. Yes, we know a lot of Clorox is being used and chemical bleaches and other things, but if they are a little bit aerosolized, lung is a very, delicate organ. So sometimes, just washing with soap and water, floors and other things can also be done at home. So just simple means go a long, long, long way.
Yeah, I actually, at my home, I use a lot of essential oils. So I will be putting essential oils in the air. I use a combination commonly known as thieves, and I use that all over my house as well. And it has a beautiful scent to it. It's not chemical. It's not bad for our earth. Not bad for the environment, and it's not bad for us either. So I love using essential oils. Do you recommend those as well?
Yes, I think, once again, the everything, whatever you do in
moderation, yes.
Important, as well as the quality. If you buy like something, it should be very authentic, FDA approved, I will say, because again, these are, I personally also use sometimes, like cinnamon kind of flavor at my home. But once again, if someone, you will come to know if someone is having new cough or something, allergic response to that, because different bodies have different genetic makeup as well as different structural properties of the lung. But I'm as I said, I personally use it. So if someone is not having any difficulties, they should use it. It produces a nice home environment, stress relaxing, and lots of good things can happen with that. I also want to add, I missed that part that vaping in teenage group, I think also should be, it should be prevented. It should not be done, as it can also be part of a bad pulmonary health, and your risk of developing some long-term pulmonary problems is going to be a little higher.
Sure. Anything that has some kind of caustic element to it or chemical element to it, we really have to look at it if it's not natural. So I totally understand where you're coming from. So one more question I have for you, and then I'll ask you questions that I standardly ask my guests on here on Healthy Lifestyle, is how do you think about having that Corey Critical Care Pavilion? How has it benefited the people on the east end of Long Island, New York?
I just want to take this opportunity to thank our, Corey Foundation itself, as well as our leadership here, Mr. Mitchell, Dr. Cacibardo. They have really made this a wonderful, state-of-art ICU. It is very well designed, 24/7, staffed by board-certified intensivists. We have very highly trained PA physician assistant group who takes care 24/7. It has, sound masking systems. It has very well lighted rooms. I think most, as I told you, that its staffing is good. Its room capacity is more like state-of-art design. So most of the critical care we can perform here. But we are not the biggest center in New York State or in the world. So we have means and capabilities of transferring to a tertiary care whenever we feel that something like, some of those advanced treatments we may not be able to give. But basic critical care, which includes treatment of trauma, treatment of septic shock,
right,
even treatment of COVID, we have done very well during COVID respiratory failure. Most of these things can be done here. The people from East Long Island do not have to travel to long distances to get the care. We know now families have to be around while critical illness. So it's a good idea to get to a place which is very close to the family, and we can provide most of the critical care here. So I'm very much happy here the way things are going in our ICU, and we are very much capable of doing the right thing at a very right time without any delay.
Yeah, without a doubt. And that's so inspiring. But you inspire, you are absolutely inspiring. I love what you wrote about something that I had asked you, and you said that your patients inspire you, and that you had this quote, and I love the quote: to cure sometimes, to relieve often, to comfort always. I love that. What was the inspiration behind that?
I think one of the things I'll say during COVID, we have noticed, like, sometimes we have forgotten those simple gestures of comforting families, like, touching hands and smiling, looking into the eyes of the patient or the families, having a shared decision making. So most of these things I felt sometimes were missing during this COVID crisis. So as a physician, I always felt, because as you see, my training has been very broad from different aspects of the medicine as well as public health.
Yes.
So I always feel that this is one of the most important aspect of being a physician, that we do not know everything about the human disease. So sometimes we have to just, reassure the people. We have to give them the right information at the right time, and that and bring some kind of a comfort in them. Maybe we don't know exactly how the disease is perfectly treated, but we want to do the right thing at the right time.
That's beautiful. Thank you so much for sharing that with us. And one other thing that I noticed about you is we have a commonality in spirituality as far as Rumi goes. And I think that's a beautiful, beautiful element that you bring in, and that passion that you bring in, and that care of other people you bring into your practice, Dr. Lone. Thank you. I really appreciate you being here. And I have one last question in our last minute of this segment, which is, what's your why? Why do you do what you do?
I think I want to end this with a Rumi's quote, which is, with life as short as a half-taken breath, do not plant anything but love.
Oh, that's beautiful. Absolutely beautiful. Thank you so much for being with us today, Dr. Lone. I'd love to have you back, have more conversations like this. Hopefully it'll be in a time when we have passed the COVID time, and everything that you're doing every day. We thank you from Healthy Lifestyle on behalf of our listeners too. So thank you for everything that you've shared, and thank you for that beautiful, lovely quote. We really appreciate you.
Thank you so much. It was my pleasure to be with you.
Well, you are listening to Healthy Lifestyle. I'm Lorianne Casdia, and we are going to take a small break, and then we're going to jump back in here with some additional expertise from our gastroenterologist, also from the Peconic Bay Medical Center in Riverhead, Dr. Sara Cerrone. We will be right back. Welcome back to Healthy Lifestyle. I'm Lorianne Casdia. If you have any questions, comments, or ideas you'd like to hear more about, please email us at healthylifestylewithla@gmail.com. And of course, follow us on social media at Healthy Lifestyle with LA. We love hearing from you, so keep those questions and comments coming. We love it, and your ideas have been wonderful. We've had great guests on as a result of your requests. The first half of the show, it was magnificent. Dr. Lone really brought us up to speed on some things that will help us relative to our pulmonary care. In this half, we're speaking to Dr. Sara Cerrone. She's a gastroenterologist at Peconic Bay Medical Center in Riverhead. And just a little background, she grew up in Floral Park, New York. She went to Stony Brook University for undergraduate degree where she played softball, and then went on to Stony Brook University School of Medicine for her medical degree, then completed residency and fellowship at Hofstra-Northwell. And she is currently the gastroenterologist, as I said, in Riverhead, New York. Welcome to the show, Dr. Cerrone.
Thank you so much for having me.
Oh, absolutely my pleasure. We really appreciate all the care and that Northwell Health actually brings to us. A lot of great doctors, and one after the other just shows how much love you all have for what you do, and it just warms my heart, and the listeners of Healthy Lifestyle always enjoy that. So let's jump right into it, because I've in the past have needed a gastroenterologist. I love my gastroenterologist because I used to have colitis, and I haven't really had an attack in years, which is wonderful. I did have diverticulitis this past February, just after I had what I thought was flu. I believe now that it might have been not flu and might have been a mild case of COVID. I stayed home because it was flu-like symptoms, similar, and it kind of combined a little bit of my flashback into having colitis attacks. So what stomach-related symptoms were you seeing during the peak of COVID?
Yeah, so there were a variety of symptoms, but I think the two most common were probably generalized abdominal pain and diarrhea. Usually the GI symptoms preceded some respiratory symptoms, so we'd have patients that would have 2 to 3 days of abdominal pain, diarrhea, maybe some decreased appetite, and then they would develop respiratory symptoms. So usually the two symptoms did happen, both respiratory and GI, but GI symptoms definitely preceded the respiratory symptoms.
Yeah, I think that's what happened to me. And then about a week later, I had a really bad attack, and I wasn't feeling right since I had what I refer to as flu, and then the diverticulitis kicked in, and I ended up going to the hospital for that. So what gastro symptoms are somewhat serious do people often ignore? But gosh, I might be able to answer this one.
Yeah. You have great experience with it. But, I always say that if you're having, either persistent abdominal pain or changes in bowel habits, whether, new onset constipation, new onset diarrhea, and obviously one is if you're seeing any blood in your stool, those are all symptoms that can be worrisome if they are persistent. So, 1 or 2 times of diarrhea, constipation, not a big deal. But if the symptoms are ongoing, and I usually say if it's going on for greater than, 2 weeks or so, it's probably time to get evaluated.
Right.
It could be nothing, but then it also could be something. So a lot of these symptoms you don't want to let linger for too long. In the drugstore, there's whole aisles with so many different GI remedies that you can buy.
Sure.
But if you find yourself consistently going to, the pharmacy to pick these things up, then it's definitely time, to see a gastroenterologist.
That makes sense. So the next part, I'm kind of chuckling to myself because I read in the news 8 reasons your burps smell horrible, according to GI doctors. It's an actual recent article. You had something to do with that, didn't you?
Yeah. So I was asked to comment on smelly burps, why they can be so annoying or embarrassing at some point.
Why should people be more mindful of their smelly burps? Well, apart from being, of course, polite.
Yeah. So it could be a sign that something is going on. As we digest food, bacteria are kind of the little digesters within our GI tract, and those are the ones that produce gas. So either flatus from down below or belching up top. And sometimes if you have persistently smelly, expulsion of gas, that can be an indication of something else going on, meaning could there be an ulcer somewhere in the stomach where you have a change in the bacteria and those bacteria, smellier, forms of gas.
Right.
Also, you want to think about, are you digesting food? Is the food leaving your stomach at the right rate, or is it kind of just sitting in the stomach and causing all these, malodorous smells to kind of be expired? So there's a lot of things that it could be. And the other thing, too, is you always want to make sure of your own dental health, because sometimes when you have reflux disease, that can affect your teeth, develop cavities, and sometimes that can be a reason for smelly burps as well.
Wow, I didn't realize that it could actually, reflux could actually hurt and affect your teeth.
Yeah. Sometimes, especially at night, when you're in a supine position, you're laying down, that stomach acid, that's just digested food, can come all the way up the esophagus and into the mouth. Sometimes patients that have really bad reflux will complain of dental cavities, but also a sour taste or sore throat when they wake after sleeping.
Wow, I did not know that. That's interesting.
Mm-hmm.
Is there anything behind having that like oily taste in your mouth?
That I'm not too sure. That might be, any weird taste that you're having in your mouth could absolutely be related to reflux, or it could just be related to the particular food that you ate.
Right.
Another thing too is dehydration can absolutely affect your taste buds. So sometimes when you're a bit dehydrated, taste can be a little bit off or a little bit different. So those are some things that you may want to consider.
Interesting. I'll have to let my friend know about that. So it really seems like, everybody I talk to, not everybody, but a lot of people I'm talking to are doing gluten-free diets. And it just seems like so many more people are doing the gluten-free diet, or they have gluten intolerance. And is there seriously a rise in the cases of celiac?
So I don't think that there's a rise in the case of celiac, but I think that we're realizing that many more people don't have celiac, they actually have gluten intolerance. So celiac disease is where your body almost creates a little bit of an allergic reaction to gluten, and you'll see microscopic changes when you take biopsies in the small intestine. That's a little bit different than gluten intolerance. Gluten intolerance more so is people feeling unwell when they've had gluten, but you don't see the same changes when you under the microscope after you take biopsies. And we've realized that as, humans are evolving and our food is evolving too, some of the food that we have is just high in things that humans aren't historically meant to digest.
Right.
One of those things is gluten and very complex, wheat products. And many times patients won't have celiac, but they'll just feel kind of crappy, for lack of a better word, after the gluten. So often I'll recommend, doing a trial with gluten for about 2 weeks and see how you feel. And a lot of times people will feel better just being on a low or no gluten diet, even though they don't have celiac disease.
So is it a bad idea if you don't have a gluten allergy to be on a gluten-free diet? Is it bad? Is it potentially harmful?
Mm-hmm. Yeah, so the thing is, a gluten-free diet is not necessarily a health. A lot of the gluten-free products are not necessarily healthier ones or have more minerals in it. So what I would say is that if you don't have celiac disease or you don't have an issue with gluten, you shouldn't follow a gluten-free diet. It's not like it's going to help you lose weight or be healthier. I would only follow that diet if you feel like it helps you from a GI perspective, but it's not necessarily the healthiest diet out there.
Interesting. Yeah, I just see everything is gluten-free here, gluten-free there, and I just find that when I'm eating too much, I get very lethargic.
Mm-hmm. Mm-hmm. Yeah. So that's definitely true. A couple of years ago, they actually did a study on brain fog. They found that some complex carbohydrates and meat products can change your score a bit, or how the bacteria digest those products. So sometimes you can feel a little bit out of it or foggy. And they found that a lot of times if you cut down on the wheat and the carbohydrates, people actually feel better. A lot more research needs to be done into it. But I often find that patients that have celiac disease and don't follow a gluten-free diet, a lot of them will complain a little bit of haziness. When they follow that diet, much more alert than they did before.
Clarity, yeah. So what are the most harmful foods that a person can eat? And why? Why is it harmful?
You mean specifically for celiac disease?
Sure.
Or gluten? Yeah, so that we love and are all around us. So any type of bread products, rice, pastas, cakes, dessert, pizza. It really is all of the food that, we love to snack on and indulge on. So, what I often tell patients that have, celiac disease, I say, it is hard. There are more things on the market now. But what you want to try to do is try to have a diet with less of the carbohydrates, and processed foods, and really focus more on fruits, vegetables, and proteins. If you make that a bigger part of your diet, then you'll be less susceptible to, having exposure from a gluten-containing product.
Right.
And really only use, the gluten-free products, when absolutely necessary.
Understood. It's so funny. Years ago, somebody said this to me, and it never left me, that if you eat like a caveman could have, you'll be eating very healthy because it was all natural. It came from the ground. So, and someone else said, well, if you only shop the exterior of a food store, meaning all the outside aisles, like the produce section and the other external aisles, you'll never go in the middle. All that stuff in the middle, you won't even miss. And I found that to be true. So are there certain foods you'd like to see your patients introduce in their diets more?
So I always say, vegetables and protein. So a lot of the vegetables that are around, broccoli, fruits like blueberries, pomegranate, have a ton of antioxidants in them. They have, a ton of fiber in them. And those are really the things that we look for. Natural fiber, antioxidants, vitamins and minerals. I always try to, push the vegetables and kind of good proteins. I look patients, like you said, to stay away from those processed foods, those middle of the aisles, because those are all of the packaged goods.
Yeah.
And those tend to have a lot of preservatives in them and just products that we don't necessarily want in our systems or are not easy for us to digest. A lot of patients will say that, when they follow a diet with more of like the food in its purest form, vegetables that are nearly, raw, they kind of feel better than all of the processed foods and foods that are super well cooked.
Yeah, I agree with that. I find that myself as well. So let me ask you a question. I ask this of all my guests is, what's your why? Why do you do what you do?
I always get that question because people are always out by what I do because they're like, you deal with the GI tract, you deal with kind of disgusting things. But for me, I feel like we are so tied in with our GI tracts. Food is such a big part of our lives, and I feel like I'm able to, help people by just really changing diets rather than using medications all the time.
Mm-hmm.
I feel like I'm able to, through GI, kind of take a holistic approach and really look at what people are eating and make recommendations based upon that to really help them. Obviously, sometimes you do need to follow, and use specific medications. You need to do endoscopies, but I've always found GI fascinating because a lot of the things that you're suffering from, can be treated by simple, dietary changes.
It's amazing how the shift goes.
Yeah. Yep.
It's amazing by shifting some of the food, how it just changes how everything is processed, and
absolutely.
And your energy goes through the roof if you're eating those healthy live food. Mm-hmm. It's really good. What's your thoughts on probiotics?
So probiotics is kind of under scrutiny recently. So my feeling is that probiotics don't hurt. Studies have been done that don't show that they necessarily provide any sort of benefit in terms of GI health or in terms of preventing infections. But I tell you anecdotally, patients will tell me that they just feel better on probiotics. It's one of those things where, if a patient tells me they're feeling better, it's something that won't harm them. A lot of times the probiotics patients get, in the capsule forms, may actually just be more of a waste of money.
Yeah.
You can get by if you're able to buy products and just get a good yogurt with plenty of, the bacteria and the probiotics in that. That's usually sufficient. You don't have to necessarily get the forms and a certain amount of, cultured bacteria. But I think that, probiotics in some patients really is helpful. So I would never tell a patient not to use it if they feel like it's beneficial.
Yeah, that makes perfect sense. In our last few minutes, if you just what are your thoughts? What did you want to share with our listeners that you feel would be really important to get out to them?
Yes, I think that first off, I'm always promoting healthcare maintenance. So for patients that are out there that have not yet gotten their colonoscopy and they're in between the ages of 40 and 50, I would strongly encourage you, to make an appointment with a gastroenterologist. Colon cancer numbers are increasing in the United States. It's happening in younger adults as opposed to adults over the age of 60. So that's something that I really try to emphasize to all patients out there. Colon cancer screening, easier than you think. The first step is really just talking to your primary care physician or gastroenterologist. It's really important for your health, and it's a way that we can prevent cancer in the future. It's
really important to get a baseline on that, right?
Exactly. So you have, a colonoscopy, and then, you'll talk with your doctor about when, you need to repeat that exam, but sometimes it could not be for 10 years, which when you think about it, is a pretty long time. And there's newer preps coming out that are definitely not as bad as preps in the past. And most of my patients, I'll tell you, will say it's much easier. The whole process is much easier.
I can attest to that because I used to have a colonoscopy every 3 months. And that stuff is just the thought of it would make me, feel very ill. And now it's not as bad. I mean, I don't have to do it as often. Thankfully, it's once a year.
Right.
But yeah, it's not as bad as it used to be. So I love that they're trying to make strides in making this whole process a lot easier, but real important to get a baseline. Are there ages that are real important? Does it differ from male to female?
So it really doesn't differ from male to female all that much, but it does differ in different patients of different genetic backgrounds. So we have found that in patients that are African American, they actually have an increased risk of early age colon cancer. So there's been a push to African Americans earlier. So where before we used to say 50 years old, African Americans now are 45 years old, that they should definitely get a colonoscopy. We haven't seen too much of a difference between males and females or, Caucasians and other groups, but definitely African Americans. They're doing more research on it, but are tending to show early at colon cancer.
Wow, that's it's great. We're getting some really good information. Well, thank you so much, Dr. Cerrone, for being on. I love what inspires you, that you love it when your patients are happy with the care you deliver, and you love referring. Yeah. You love the fact that they're so happy that they refer their friends and family. That's a beautiful thing, and I can hear the passion that you have for the business that you are in. So thank you so much for joining us today. And thank you all for joining us on Healthy Lifestyle. I'm Lori Ann Casdia. My heart is always lifted by sharing this time with you. I really want to thank our doctors today, Dr. Nazir Lone and Dr. Sara Cerrone. They are both added so much information. We learned a lot today. But I also want to remind you, we are here to serve one another. So please take a moment, step out of your day, do a little something for yourself. Or someone else, I should say. And I really appreciate you all following us. I look forward to spending this time with you again next week. Thank you for joining us on Healthy Lifestyle today. I'm Lori Ann Casdia. Until next time, play a higher role, serve a higher purpose, show up for you, and show up big.